Hello, today I'll be speaking about physician-assisted suicide. More specifically, why terminally ill patients should have the right to physician-assisted suicide. Physician-assisted suicide, otherwise known as PAS, can only be initiated by the patient. According to a campaign group that supports PAS, which is deathwithdignity.org, PAS can only be requested by terminally ill patients who have been diagnosed with less than 6 months to live. According to the Oregon Health Authority, the request must be signed by at least 2 witnesses, one whom cannot be a relative, the patient's doctor, nor a person entitled to any portion of the patient's estate. So this just means that if the patient does request for lethal medication to do physician-assisted suicide, they have to have themselves, someone who could be anybody like their family member and their doctor, and someone else who is not their family member, so like a friend, to initiate the process. In Montana, the request must go through the state Supreme Court. So the physician-assisted suicide, the process to actually get the medication is pretty difficult, but not difficult, but like there's a lot of checks and balances to make sure that it's not like used for suspicious activities or anything. So only 5 states have currently allowed physician-assisted suicide, California being one of them. 7 if you count Washington, D.C. and the District of Columbia. The rest of the United States does not allow this practice. This is a problem because many terminally ill patients express that they want a hastened death. According to the Oregon Health Authority, 91% of patients who seek PAS want to pass because they have lost autonomy. 89% seek the lethal prescription because they are less able to engage in the activities that they would like. And 81% say it's because they've lost their dignity. There are many other reasons like loss of bodily functions and they can't afford to keep living in the hospital, but those are just the big major ones. Also, according to the American Psychological Association, more than 60% of terminally ill patients with cancer or AIDS are under a constant pain. So that may be another reason why these terminally ill patients want to, end their suffering, to put it a nice way. Another reason that PAS should be an option for patients is the price. According to the Time magazine, about 28% or about $170 billion of Medicare is spent on the patient's last 6 months before they die. By allowing the option for terminally ill patients to seek lethal prescriptions, hospital bills will definitely decrease because not everyone who's terminally ill will commit suicide through this program, but there definitely will be less terminally ill patients because of this. According to healthcare.gov, the average cost of a 3-day hospital stay is around $30,000. So if you do the math on that, it's about $10,000 a day. So getting cancer would be horrible for someone who has bad insurance or no insurance at all. With medical bills like those, I would want to get some physician-assisted suicide. The final reason why terminally ill patients should have a right to physician-assisted suicide is that many of the people want it. According to deathwithdignity.org, 7 out of 10 Americans support the option of having physician-assisted suicide because I guess Americans, the American way is just to be your own man and choose what you want to do. So when California was deciding whether or not to legalize PAS, Governor Jerry Brown stated that, "I do not know what I would do if I were dying in prolonged and excruciating pain. However, I am certain that it would be a comfort to be able to consider the options afforded by this bill, and I would not deny that right to others. Even though he is a known Democrat and was a former Catholic seminarian, he still passed the Death with Dignity laws in 2015, making California the 5th state in the United States to have death with dignity laws. So the current system, it doesn't work because only 5 out of the 50 states actually have these death with dignity laws that allow terminally ill patients to end their suffering a little early. So what the affirmative side proposes is that every state in America should push past these laws, because terminally ill patients should have the right to see terminally ill patients should be able to end their life or live the life that they want, and if they are sick and the quality of life is lower than normal, well, not lower than normal, but if their quality of life isn't worth living, then they should have the right to be able to commit suicide using the PAS program. Thank you.